Namaskara. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have a renowned multi-organ transplant surgeon, Dr. Suresh Raghavaya. He is not only trained here in India, in France, as well as in Mayo Clinic, especially for the post-transplant immunotherapy. And more than that, he is a committed person who is committed to bring awareness among the public. And hence today he is with us to tell us what is jaundice, why it comes, how to treat and why to treat, and what is the importance of detecting jaundice in a patient with the liver disease. Welcome, Dr. Suresh.
Thank you very much, Dr. Villajimi. Always a pleasure to be on your show.
Yeah, it's such a nice thing, because I always learn from you, and then and you explain so beautifully. Now,
Thank you.
my own very,
Mm.
very close associate who worked with me for 20 years, she had a ovarian tumor, and then she went to all treatment was over. That she had chemotherapy, radiotherapy, everything. And then when she went to get her scooter repaired, the fellow repairing the scooter, he said, Amma, Dr. Amma, your eyes are yellow. And she had not noticed until then. So that means if
Mm.
a doctor can miss it, even ordinary people can miss it
Yeah,
because
absolutely.
they are not bothered unless somebody is looking into their eyes regularly. They may
Yes.
not look at the yellow color. And even the dust allergy, sometimes the yellow color,
Yellow color and this
yeah,
color.
muddy sclera also can
Absolutely.
make them look like yellow. But
Yes.
now, this yellow color or the jaundice is extremely important because
Yes.
it can occur in a number of conditions, and once it is there, that means that the liver is not able to handle the situation. So they
Situation.
have come
Yes.
at the last stage. So please
Yes.
tell us about the jaundice. The little children will forget because we have the
Yes. Yes.
pediatrician to
Yes.
tackle. You tell us
Absolutely.
about the adolescent to the adult and the old people.
Lovely, Dr. Vijayalakshmi. So first thing to remember is jaundice is not a disease, but it is a
Yes,
symptom of a disease.
it's a
Jaundice ಅಂತ jaundice
manifestation.
ಕಾಯಿಲೆ
Yes.
ಆಗೋಯ್ತು, ಕಾಮ್ಲೆ ಕಾಯಿಲೆ ಆಗೋಯ್ತು, they keep saying.
Mhm.
Jaundice is not a disease, it is a symptom of a disease which is
Yes.
pointing us to something else that we need to follow this signboard of jaundice to find out what
Yes.
exactly the patient
Yes.
is suffering from. Now, first, if you understand what causes jaundice, it will be very easy to understand what the different diseases are. So, how is jaundice produced? Basically, jaundice is nothing but deposition of a pigment called bilirubin in the skin and in our eyes. Now, where does
Eyes.
bilirubin come
Yeah.
from? It comes from the red blood cells. Now, the red blood cells
Yeah.
have a lifespan of about 120 days. Now, once 120 days is over, they go to the spleen. In the spleen, they're destroyed, and that is what forms bilirubin. Now, this bilirubin is called unconjugated bilirubin.
Unconjugated.
This now
Yes.
goes to the liver. In the liver,
Mhm.
conjugation of bilirubin takes place. Okay,
Okay.
once conjugation of bilirubin takes place, it is excreted into the bile ducts. Then it comes
Yeah.
into the stored in the gallbladder, and through the bile duct, it goes into your intestine, where we
Mhm.
excrete it naturally. Some amount of it is
Okay.
absorbed into the bloodstream, and we excrete it in the urine. Some amount of it we excrete in the stools. But the thing to
Stools.
remember is, yes, 80 to 90% of this bilirubin we absorb back so that we can
Okay.
reprocess the bilirubin. It is very important.
Yeah.
And one
Yeah.
interesting fact is your urine is yellow and your stool is yellow because of this bilirubin, which gets converted to urobilinogen and what we call stercobilinogen.
Correct.
Now,
And
any inter
one thing we must remember, when there is an obstruction for this bilirubin to go into
go
the
down,
duodenum or the intestine, the stool will be white color and
white,
the urine
yes,
also will be less. And when the
yeah,
jaundice is more, the urine color is very, very dark,
very
I mean,
high,
very yellow,
yes,
and the stool
yes,
also will be very dark. So the color
absolutely,
of the urine
absolutely.
and the stool also changes depending on the obstruction
Absolutely.
or no
And
obstruction. Yeah.
actually, if you notice, most of my patients who come from villages will come purely because they say they notice that the eyes are not yellow. They'll say the urine is yellow. So that is their
Ah.
ಇದು ಸರ್ ಯಾಕೋ ಮೂತ್ರ
Yeah,
ಕೆಂಪು
correct, correct.
ಹೋಗ್ತಾ ಇದೆ ಅರ್ಶನ ಹೋಗ್ತಾ ಇದೆ ಅದಕ್ಕೆ ಕರ್ಕೊಂಡ್ ಬಂದ್ವಿ ಅಂತ.
Yeah,
So now
correct,
as we're saying,
correct.
so any disruption or an imbalance in the cycle will
Yeah,
increase the amount of bilirubin in the blood, and that is what presents to us as jaundice because this bilirubin is
okay.
going and depositing in the eyes, in the skin, everywhere, and
Hmm.
that is what causes Jaundice. So
Mm.
jaundice itself is not a disease. It is
It
pointing
is.
at us to a disease. Now, what are the common things
Then,
which we can look
yeah,
about?
what are the common
Any
things? Yeah.
disease where the red blood cells are getting destroyed more, like you have your hemolytic anemia, thalassemia, sickle cell disease, which again are more common in the pediatric population. But in the adult, when do these things happen? When you have dengue or leptospirosis or any other viral infections, lot of blood cells get destroyed, and that itself
Mm.
can lead to jaundice, right? Then you have infections of the liver, like your hepatitis viruses, hepatitis A, B, C, D, E, again dengue, leptospira, or some atypical viruses come and damage all the liver cells. At that
Mm.
time, what happens? The liver has both conjugated bilirubin and unconjugated bilirubin, whose levels are going to rise in the blood. Now, as opposed to now, let us say if at all there's any pathology of the bile ducts where the liver has already produced bile and is pushing out to the bile ducts. Now, let us say there's an obstruction. Let us say the patient has a gallbladder stone. The stone slips down into the bile duct and blocks the bile duct. Or there's gallbladder cancer, or there is cholangiocarcinoma, which is cancer of the bile ducts, or pancreas cancer. The bile duct gets obstructed. So, what happens? The bile
Yeah.
cannot come down. So, it gets back into the bloodstream and it causes jaundice. So, this is
And many a times what happens is the cancer may be elsewhere, and they may not be
absolutely.
aware that they have got a
Yes,
primary
yes,
cancer
yes.
in some. When they have the
Absolutely.
secondaries and obstruction, and then they
Hmm.
come. By then
Then
it
they
is too
come.
late to do
It
anything,
is too
So
late.
that, yeah,
Absolutely.
yeah.
Yeah, that is the one thing about jaundice. So generally, especially in cases of obstructive jaundice or hepatocellular jaundice, whenever there's a jaundice, what we say it is a harbinger of doom ಅಂತ ಹೇಳ್ತೀವಲ್ಲ. So it is not a
Mm.
good sign, especially if it's an older patient who's been
I
smoking or
know,
drinking
I know.
heavy alcohol with air pollution and
Mm.
everything. An elderly gentleman who comes to us jaundice, it is definitely never a good symptom to have because it
Okay.
tells you that whatever disease process he has is generally in a much
It
more
come to the
advanced stage.
ultimate, yeah. Mm.
Yes,
Yeah.
yes, yes.
Mm. Now, how do you detect that the jaundice is more, and what are the investigations that have to be done?
Right. So this is very important. So this is why I keep saying, see, the way God has made liver is that
Mm.
if only 30% of the liver is working, your blood test will be
Mm.
totally normal. In the sense,
Mm.
70% of the liver should get damaged for it to show up in your blood test, unless, of course, it's
Mm.
an obstructive jaundice where the bile is not at all able to go down, right? And this is the importance of a master health checkup or an annual health checkup after a particular age, because your blood test
Mm.
can be completely normal, but you might be harboring disease in the abdomen over there, right? So whenever you
Mm.
do a blood test, the simple platelet count will tell you whether the liver is damaged. If the platelet count is low, it generally tells you
Mm.
that the liver is damaged and the patient has something what we call as portal hypertension. Then you look at
Yes.
the liver function test, you will look at the bilirubin levels. You have a total bilirubin, conjugated bilirubin, unconjugated bilirubin. You will see which of them
Okay.
is high. If the unconjugated
Okay.
bilirubin is high, what does that mean? It means there is a blood pathology or the liver cells are getting damaged. Whereas if your
Mm.
conjugated bilirubin is high, what does it tell us? It tells you that there is an obstruction somewhere to excretion of the bile.
Mm.
We need to investigate accordingly. Now, if it is an
And is the
unconjugated
ratio also important? The
no,
ratio of
generally,
the two?
yes.
No,
So,
it isn't.
absolutely. So,
Okay.
if the direct bilirubin is more, you're always worried about
Mm.
obstructive pathology. If the unconjugated
Okay.
bilirubin is more, it is either because of your liver cells being damaged by either viruses or something else, or because you have something in the blood which we need to figure out.
Okay.
Now, once
Okay.
we do that, let us say your conjugated bilirubin is high. Next, we're going to go with an ultrasound to see if at all there's any gallstones present, if there's a gallstone which has slipped down into the bile duct, or if you can see any mass in the thing, or whether there are any masses in the liver. Now, like you
Mm.
rightly said, if at all there are secondaries in the liver, patient is going to develop jaundice, right? But not until later stages. Like I said, at least
Yeah.
60-70% of the liver should get replaced by tumor because before you can
Oh.
get jaundice.
Mm.
And this is the reason early detection is key. Now, let us say we found something over there, then we are going to go ahead and do a CT scan to see what exactly is causing the jaundice, whether there's a mass in the pancreas, whether there's a mass in the liver, whether there's secondaries in the liver. If required, we do MRI and MRCP and PET scan and so on and so forth. But the problem with nowadays is all people kind of jaundice ಬಂದ್ರೆ ಎಲ್ಲ ಒಂದೇ ಸತಿ ಮಾಡಿಸ್ಬಿಡ್ತಾರೆ, which is the wrong thing
Yeah.
to do. We
Yeah.
have to apply our brain, see what kind of jaundice it is, what is the age of the patient. A younger patient is more likely to have either an infection or some other disease. A person who is drinking alcohol regularly is likely to have cirrhosis of liver and jaundice. Whereas a
Mm.
much more older gentleman who has a history of smoking or drinking is more likely to have a cancer and then
Mm.
jaundice. So not all jaundice are the same. Although they
Yes.
appear as the same, not all
Yeah.
jaundice is the
They're
same
not.
disease. And this is where
Correct.
we need to sequentially investigate the patient and then treat accordingly.
Yeah.
But
Yeah.
as all
That's it.
diseases,
Yeah.
early detection is key.
Very, very important. And that's why
Yeah.
the symptoms of the patient and their appetite and whether they're able to eat or not, or
Eat.
whether
Yes.
distension or the swelling in the legs or jaundice,
Absolutely.
puffiness, all those things are extremely important. And what
Important.
is more
Yes.
important is their habits. So those who have
Absolutely.
got the
Yeah.
bad habits, and the bad lifestyle, they must get themselves investigated in time. Otherwise,
Absolutely.
they are bound to get into trouble sometime or the other. And
And most often or not, it
ultimately,
is too
yeah,
late for to us to help
yeah,
them.
too late, too
You know?
late, too
Yeah.
late. Okay.
Yeah.
So, what are if they come early, what are the things that are done? And if they come late, what are the
So very
surgeries
important.
that
So
are
if at all they
possible?
come,
Yeah.
let us say it is just a case of acute liver failure. Let us say the liver is absolutely fine, just a viral infection is there. It's very easy to treat viral infections right now. We just invest. If it's dengue, obviously we give supportive care, leptospira. All these are self-limiting diseases where we just give.
Yes.
Now let us say the patient has hepatitis A or hepatitis E. They are also
Mm.
usually very self-limiting. You give them supportive care, give them some IV fluid. They'll have a lot of vomiting and gastritis symptoms. You treat them, and within about 4 to 7 days, they are on their way back to recovery. Why? Because the liver has an amazing potential to regenerate. So now, right now in our living donors, we cut and take away 70% of the donor's liver. Within 6 weeks, the liver grows back to normal size. So in all these acute cases, you don't have to worry because you just support
Yeah.
the liver until the liver damage stops and the liver will regenerate. If it is hepatitis B, hepatitis C, it's again, we do a lot of blood tests to see if the how much of virus is there in the blood, and based on that, we're going to treat. Now, the good thing with hepatitis B right now, it is completely controllable.
Vaccine. Yeah, vaccine is
Yeah,
available so
very
that can be
important that if you
prevented.
can vaccinate the children at a young age, hepatitis B is completely
As soon as the
preventable.
child is born, the first thing given is the hepatitis vaccine.
Hepatitis B vaccine,
Yeah.
very good. So that is completely preventable. And even if it's an acute virus B infection, we have very good tablet right now. One tablet twice a day in about 6 weeks time to 3 months time, they eradicate the virus, and that treatment they'll have to take lifelong. Hepatitis
Okay.
C initially was a very, very bad disease to have because the treatment itself was much more toxic than the
Yeah. I know,
disease
I know,
in
I
most
know, I
cases.
know.
But
And the
right now, it is just,
side effect of the drugs was so much.
yes.
Patients will never used to come
Come
back
back to
with
take
yeah.
treatment. Yes, so right now it is just one tablet you take for about 12 weeks and you can eradicate hepatitis C. So this way, once the acute phase is over, the liver will regenerate and completely be normal. But in some patients who come really late, like that's a patient has been abusing alcohol for a long time, or he's had severe fatty liver disease because of diabetes and hypertension and high lipid profiles and everything. It's very important for us to catch these guys also early so that you can talk to them about lifestyle changes. Stop alcohol, start exercise, avoid high calorie diet, and become
Correct.
thin. The liver, again, maybe not to 100%, but 40-50%, even if it regenerates, their jaundice levels will come down and they will be able to lead a healthy, normal life. But whereas if
When you are describing the liver and its function and its ability, I think that the liver is like a mother in the family. She
yes,
continues to work till the whole listing, and even at the end
yeah,
also she continues to see that
continues to
all the
work.
family
Yes,
members and everybody is fine.
it's
Probably
happy.
our
Yes.
liver is can be said that it is like a motherly thing, and tries its best to
Take care
protect
of.
and then
Yes,
care of us.
yes,
That's
yes,
a
yes, yes.
wonderful thing.
Now,
Yeah.
absolutely. So now, if at all it's a cancer, let us say it's a pancreatic head cancer, which is blocking the bile duct, or a gallstone, which you can just do an endoscopy and remove the stone, and that is about it. If it's a pancreas cancer, you operate. If it's a cholangiocarcinoma, the cancer of the bile duct, you operate. Right now the operative techniques are way beyond. We do laparoscopic surgery, we do robotic surgery, where the recovery period is very, very fast.
And
So, but
interventions
I
also have come. Suppose there is a block in the bile duct, you can stent it, put a stent
Tented,
like how we
exactly,
do for the coronary.
absolutely,
So the
absolutely.
people
So it's a
don't have
very,
to
very
worry.
simple
Yeah.
thing. But for
Hmm.
all of these things, what is mandatory? A
They have to
detailed
come
history
early.
taking.
Yeah. Yeah.
Absolutely. So, and this is where history taking is very, very important. It's not all about doing blood tests. It's not all about doing CT scans and MRI, especially when it comes to evaluating jaundice. A simple, good history taking will give you the diagnosis. So it is
Yeah.
very
Yeah.
important to come to your
Yeah.
doctor early so that we can
Yeah.
investigate what the cause of your jaundice is and treat accordingly.
Thank you. Thank you so much, Dr. Suresh. You have hammered the important points. Never ever miss the jaundice. Come
Yes,
as early as possible. And
yes,
earlier you come, the better the treatment
better.
is and the
Yes,
better the results of the treatment. So you
absolutely.
have to think and keep away from the smoking, drinking, and the infections. And
Yes.
then, efficient people like Dr. Suresh are there. So don't worry, you come to
Mm.
them. Thank
Yeah.
you very much. Thank you.
Thank you, Dr. Vijayashree. Thank you so much for this opportunity. Bye.